Sister told me when we first entered, give Susan time to fall in love with us. And it didn't take long.
I thank God for places like Mary Health. It's a great ministry they have.
I've never had such love.
It's got the best reputation.
I'm just going to listen to your heart.
My experience with my mother here has just been wonderful.
It is beating.
He doesn't want to come home, actually.
Everybody has an eye on them, and it's a caring eye.
They are really a blessing.
This is home for both of us.
The nuns and the people here feed your soul.
There's a peaceful presence here. I think it's a place of peace, which for me is God.
We don't come to the facility without saying our prayers.
The face of Mary Health are the sisters.
Oh, the sisters, I love them.
Oh, I love the sisters.
I love them because they bring peace to me and to the whole environment. They're just so kind.
Well, it's good they're wearing white. They're like angels floating around here.
They are always smiling. It's just so joyful.
The way they treat the residents,
Can I give you a cup? Yes, you can. Thank you.
the residents' families, the staff.
Their love and compassion comes to staff. So you feel like you're coming home every day that you walk in.
As a servant of Mary, our main mission is the spiritual care of a person, which also goes along as nurses, as religious nurses, with the physical care. It all goes together.
The care is excellent.
Each sister has their own gift, and I would say some are very gifted in bringing that consolation.
Through the love and compassion of the sisters, all of a sudden, you turn around and the person has strength and they're eating and they're motivated and they're laughing. And then therapy comes in and we work on strength and balance and coordination.
From left field.
He has made immense progress. They've worked so hard with him.
Our rehab approach is a little bit different. When we look at a person who comes into Mary Health, either for a long-term or post-injury or accident, we're looking at them as a whole person.
We just love it here. I mean, I love it here because he's getting the best of care.
It's not just the physical therapy, but it's the emotional therapy and definitely the spiritual.
There's something about this place. When you see the sisters talk to someone and sit with someone and laugh with someone, if you see the time that they spend caring for their face or their hair or holding their hand, you realize that you're just a small little piece of something huge.
For me, I enjoy that, getting to know the people, listening to the people when I have that time to really be there and listen, because a lot of times, a lot of the anxiety of someone who is sick is just a need to have someone listen to them.
By now, I have 6 children.
Yes.
19 grandchildren.
19.
And 30 great-grandchildren.
30 great-grandchildren?
Howdy, howdy, howdy out there in television land.
We had a wonderful group of volunteers really dedicated to Mary Health.
I do the zanies.
You think you've flown before, but you ain't left the ground.
Those things make a big difference for the residents, and they love it.
There's so many different ways that people volunteer here.
Hello.
Coming, reading to the residents.
After a while, Joe was snoring on the living room floor on top of his baby blanket.
Painting fingernails.
Now Susan, after we do this, you're forbidden to wash dishes or do gardening. It's just a wonderful time to sit one-on-one.
Taking them out in the garden.
The gardens are a particular blessing.
The pond, the koi fish, the ducks, the trees, the landscaping, it's just lovely.
And that's a donor.
Her whole desire was to bring a place of beauty and peace for the residents and their families.
And so the gardens here are just a treasure.
I have a hobby of drawing. So everyone that comes here, I draw them a picture of flowers, of animals.
He visits residents and he holds their hand. And he draws pictures for the new ones that come in.
Cases like that make Mary Health special.
It's really a family atmosphere here. It's just wonderful.
It becomes a home. It's not just an institution.
It's hard to have mom in the long term. But it's not when the long term is taking care of her.
Jesus and Mary, the ones who run this place. We are here for them. We are just the instruments. We are the hands and voice and eyes of them so that we can provide the care.
They encourage you to live these last few years and enjoy these last few years and not just wait for that last day.
We're just grateful because we're all united in the mission and the care of every resident here.
At Mary Health, you really become family.
We are just happy to be here.
I've been around a long time. I'm 98 years old. Being here is like heaven on earth.
I just know that God is here.